So why ultrasound and why now? Ultrasound's been used in medicine for over 50 years. There's been a revolution in ultrasound technology, and this has just been very recent. This has resulted in ultrasound systems that are now smaller, cheaper, and more user-friendly than their older counterparts. There are laptop-sized ultrasound machines that now rival the largest systems in quality of images and information that can be obtained from patients. These portable devices have rechargeable batteries, and they can be used virtually anywhere, from the emergency room to the battlefield to the space station. We now even have handheld ultrasound devices that can fit into your coat pocket. We are truly talking about the stethoscopes of the 21st century. So what value does ultrasound bring to patient care? Point-of-care ultrasound allows quick bedside diagnoses that can dramatically improve patient care. Some examples. A patient can be seen in a doctor's office and emergency room with abdominal pain. Do they have a gallstone as a cause of that pain? With ultrasound within minutes at the bedside, you have your answer. A patient's been in a motor vehicle accident and you're concerned about internal bleeding. When you lie back, blood will pool in certain areas of the abdomen. If the patient does have internal bleeding, that can be detected with ultrasound at the bedside, and the patient can be sent to the operating room for life-saving surgery. Ultrasound can be used to guide procedures, such as the placement of a needle or catheter into a blood vessel. With ultrasound, we have the ability to see inside the body and guide the catheter straight to the vessel, thus decreasing the number of required sticks and decreasing the risk of the procedure. Ultrasound can be used to detect aortic aneurysms, fractured bones, fetal abnormalities, detached retina, and can estimate the risk of stroke from a narrowed artery. The list goes on and covers virtually every specialty of medicine. Because of the great clinical utilization of ultrasound and the added value as a teaching tool in subjects such as anatomy and physiology, in 2006, the USC School of Medicine introduced ultrasound across all 4 years of medical school, the first medical school in the nation to have a fully integrated ultrasound curriculum. With the help of a Duke endowment, we've been able to introduce ultrasound into rural primary care in South Carolina, usually one of the last patient populations to benefit from new technology. With the Sisters of Charity grant, we've introduced ultrasound into the Columbia Free Clinic to help manage patients with hypertension and heart disease. Because of our educational programs, we were asked to be the host university for the first World Congress on Ultrasound and Education. It's being sponsored by the Society of Ultrasound and Medical Education and WinFocus, two organizations that have been leaders in ultrasound education and helping those with limited access to health care. The World Congress is a wonderful opportunity for the university, the community, and our state, as we believe this will be a historic event. Ultrasound has the potential to fundamentally change how we teach and practice medicine and to improve health of millions of those in greatest need throughout the world. And South Carolina is leading the way. At the World Congress, we will have experts from across the globe giving lectures and leading workshops. We have invited all who have an interest in ultrasound to submit their work for review and for presentation. We have already received abstracts and have registrants from across the United States, from Ethiopia, Bulgaria, India, Germany, Romania, and a number of other countries. The World Health Organization has committed to send representatives from Geneva because they want to learn more about the benefits of using ultrasound in developing countries. We'll be having leading manufacturers of ultrasound equipment, such as GE Healthcare, in attendance and exhibiting at the World Congress. Our goal is to have world leaders in ultrasound education, clinical application, and innovation come together in Columbia, South Carolina to exchange information, establish global relationships, and to set the direction for ultrasound and medical education to improve the health and well-being of individuals across South Carolina and across the globe. We also want all participants to leave the World Congress knowing that Columbia is a wonderful place to live, learn, and work. We have much to be proud of.